I just got to interview a psychiatrist from Amen Clinics, and she and I talked about the effects of alcohol and sometimes other substances on the brain and how neurological pathways get changed around and what we can do about those things to see peak brain health. I was stunned at the amount of things that substances do to our brain and our body. And remember, the brain is the entire operating system for everything that functions in our life. And so we definitely want to know how what we put into our body is affecting this operating system. And so I'm hoping that you join in and listen to what the chemical impact is on this organ of ours, the effect on neurotransmitters, and how we have brain health. So that's the good news. And this is only part one of two, because part two is where we go over the results of my brain scan. So tune in. Welcome, everybody, to the Say Goodbye and Imagine podcast. And boy, do we have a special guest this week. Dr. Lisa Parsons from Amen Clinics is with us. And we are actually going to do a two-part episode. We're going to talk about brain health. We're going to talk about how addiction can affect the brain. We're going to get into areas of substance use, overuse, what's going on in the brain, how does it change our neural pathways and how we process information. And of course, for anybody following me, they know this is where I light up. I I love learning about the brain. I actually just completed my evaluation with Dr. Parsons yesterday. We went through some stuff. And so this is going to be a two-part episode. First episode, we're just going to find out about brain health in general. And the second episode, we're going to go into some of the findings that were discovered in my brain scan. So let me tell you a little bit about Dr. Parsons before we start. She graduated from medical school from Wayne State University in Michigan. She's practiced in various settings, including consult liaison on medical floors and in emergency departments, inpatient psychiatry, medical director for the largest community mental health center in northern Arizona, addiction and recovery work, including detox, residential, and outpatient. She's also run a private practice with a primary focus on holistic care, which I love, and understanding the biological contributions that manifested as psychiatric illnesses. Dr. Parsons is passionate about helping to end the stigma of mental illness. Amen, amen. Which opens doors for people to seek help and improve the quality of life, not only for the person seeking help, but also their friends and family. Whew, do I resonate with that? A couple more things before we start. One, because we are interviewing a doctor, I want to just share that the content of this podcast is for informational and educational purposes anyway. Only the views and opinions expressed are those of individual guests and do not constitute any medical advice. Always seek the guidance of a qualified healthcare professional with any questions you may have regarding your health, your medical conditions, or treatments. Never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast. If you are enjoying our podcast, please follow and recommend to others, because we want the word to get out there. We want stigma to go away. And, we're excited to talk about these things that are just part of life. So, with all that being said, welcome, Dr. Parsons. It's so nice to have you.
Good morning, Roseanne. Thank you so much for having me. It's nice to see you again.
Yeah, didn't take long, right? 24 hours. Let's do a lot of my followers actually have heard about Amen Clinics. I've been doing a few posts about brain scans, and so it's kind of getting, you know, a little bit, there's curiosity out there. And so let's just start with Why would somebody go to Amen Clinic for a brain scan?
We have people that come to see us for a variety of reasons. Some people just want to see the health of their brain. They want to prevent any issues down the line, and they'll come and see us just to really optimize how they're doing. Others might come to see us because something is going on and they want to know specifically what is it and what can be done to help it, either holistically or with medication, usually a combination. We take a very holistic approach, meaning we look at the whole person. So we're going to talk about lifestyle factors, diet, exercise, supplementation, meditation, relaxation, prayer, the various things that are helpful for our brain, in addition to specifics on what we're finding on the scan. So people might have depression, bipolar disorder, anxiety, OCD, attention issues, psychosis, a whole variety of things that they may come in for. And often people have failed many doctors before they do come to us. And so there is often a sense of frustration and sometimes desperation with people when they come in.
Yeah, and boy, I got hooked on Dr. Amen. I found out about Dr. Amen through a nurse that she had some brain trauma, like she had gotten a car accident and she ended up going to Amen clinics and she was just talking about all the amazing things she learned about herself and that, the physical evidence of what she was experiencing showed up. And I was super into that. My kind of gig is understanding science of the brain and my limited capacity, right? But matching it up to scriptural references. And so I'm just fascinated at the brain and about the brain, how it works, how neuroplasticity works, what you have to do. And of course, when it comes to addiction, it's so fun to watch transformation using all the science as to how I understand it. But Dr. Amen and everything you guys do, for those who haven't been introduced to him, he's basically saying doctors, psychiatrists are literally the only ones diagnosing and issuing medications without looking at the organ that they're diagnosing, right? Would you want your gastroenterologist to diagnose something about your liver without looking at it? And it's such common sense. And that's why I've been fascinated with it. I wish I had the before picture. Maybe we'll talk about that in part two. I would think that I had a lot of lights off in my brain when I was dealing with what I was dealing with. But yeah, thank you for that. So, because of course you are an addiction specialist, and I want to educate people, including myself, about what does even moderate substance use, what is happening to the brain when we're using substances? And does it matter whether the substance is alcohol or marijuana or cocaine? Or I mean, I know they initiate different responses, but overall, what are we doing to our brains when we're using substances?
So I would even take a step back further from that question and ask, why did a person choose those substances in particular? Because what we have found with brain scanning, and even without brain scanning, it's always important to ask, what is this doing for you? Because people are, generally speaking, self-medicating. If they are gravitating toward a specific substance, it's important to find out what is that one in particular, or what is that category, and then extrapolating from that, what is that substance doing to the brain? Therefore, a person is self-medicating something going on by bringing in that substance. So there is an element of a person often trying to relieve suffering. They're
Mhm.
experiencing something, they're relieving the suffering by the substance they have found relieves the suffering. Now, some people are vulnerable to then getting into a place of addiction. So for some, maybe it can be experimental. Maybe it can be a social thing. Not that that's ever a good thing, but it can be the case. For others, there is a vulnerability that exists inside of the brain that can take it and turn it into a boulder going down a hill. It becomes a spiral. It really tips off that vulnerability and creates a sense of, I can't be without this thing. This thing is incredibly important. I'm going to, avoid work. I'm going to go against what people are telling me in order to get this. So, really getting to a place of addiction and dependence and all of the things that can come with it. So, a person that is using substances sporadically often has a different brain than someone who is using substances on a chronic and excessive basis.
Mm.
And what they're experiencing inside of their brain, what the repercussions are, is dependent upon the substance that they are using. So, for instance, if it's alcohol, alcohol is going to often be the drug of choice or substance of choice in a person who has a lot of anxiety, a lot of tension. There's a lot of emotions that they just need to settle down. And so when they're using something like alcohol, they're actually helping to raise something in the brain called GABA. GABA is the inhibitory neurotransmitter. It settles things down, but it's temporary, of course. And the equal and opposite reaction occurs when the substance wears off. Now, glutamate is raising up when the substance wears off, and the brain goes into an excitatory state. Now, that's when a person is agitated, anxious, maybe they're sweating, maybe their blood pressure is going up, and they're even at risk of having a seizure when something like that's going on. And of course, this is independence. The longer a person is using something like alcohol, the more the lights dim, the more the activity inside of the brain really begins to shut down because the mitochondria, which are the engine centers inside of the body, are being poisoned. So they're
Mhm.
not functioning the way they should anymore. And now the body and brain doesn't even have enough energy to do all of its normal functions. And then a whole bunch of problems, of course, can stem from that. The other thing that happens inside of the brain when a person is drinking alcohol excessively is blood flow goes down. It's because of the dehydrating effects of alcohol, but it's also because alcohol causes cardiovascular decline. So things start to get kind of rusty. They're not fluidly, our vessels aren't fluidly that conduit for blood to flow through and therefore be delivered to every part of our brain. The vessels have plaques that are building up, they have damage, the endothelial lining of the vessels have damage, and now blood flow is falling in areas of the brain.
More base now you have to remember you're super smart, and I have to take that and go, "Wow, how do I make sense of that?" But one thing that you're saying that I see so consistently from start to finish, including my own personal experience, is this, and I never knew this before, but it's this heart health thing. My blood pressure was just raising and raising and raising, and I was going to the doctor, and they were like, you really should consider medication. I want you to start monitoring this. And oh my gosh, it started at a consistent 140 over 90 at least. And then, after drinking 155 over 97. I mean, it was just so frightening because I did get a monitor. And blood pressure is something we don't pay attention to, right? My resting heart rate was in the 90s. Like, wow. And I know, my first jaunt with coaching was with the program that helped me, and there were a lot of executives in there, and they would like their resting heart rate just went way down and their blood pressure went down. So yeah, this is information that the general population just doesn't know about. And I assume even in moderate drinkers, it's affecting how your heart is operating.
Absolutely. And so I'll speak to that where alcohol specifically causes cardiovascular disease and therefore can cause things like high blood pressure. So alcohol is a toxin. Doesn't matter how much of it you're putting in your body. It's
Last
actually a toxin.
one carcinogen, right?
Yeah. And it's a legal toxin. And so we think, oh, it's no big deal. It's legal. You can go down at the store. You can go to Fry's and pick it up. So it must be okay. Well, because it's a toxin, it's causing cellular damage. It's causing damage to a lot of areas, including the mitochondria, the endothelial cell lining. So, the endothelial cell lining is the lining inside of our blood vessels, and it's critical. It actually helps us to do things like know when to vasodilate, know when to allow more blood flow to various areas, know when to vasoconstrict, so to decrease the blood flow to various areas. And its health is incredibly important to every organ in our body because the blood vessels feed every organ in our body. So if our endothelial cell lining is struggling, then our organs are going to suffer. And you can just fill in the blank of every organ you can think of: your eyes, your GI system, your cardiovascular system, the integumentary system, everything, the kidneys. The kidneys are involved in blood pressure. The endothelial lining is involved in blood pressure. The heart is involved in blood pressure. When people drink excessively for extended amounts of times, the heart can actually get bigger, but not in an effective manner, in an ineffective manner. And now it's not pumping the way that it should. And arrhythmias can come from that. It really is just kind of a string that when you start pulling on it, it just unravels all over the place.
Yeah, and again, I think people listening probably can associate with everything you're saying. They don't feel good. I've never felt healthier in my life, and I'm like, "Why didn't anybody tell me alcohol caused this much damage in my body?" But we can, if not caught too late, we can recover from it, and we can talk about that later. I do also want to put some languaging around the GABA and the dopamine and the what was the third thing that you mentioned?
Glutamate.
Uh,
Glutamate.
glutamate. So in my normalized trying to figure out language, you know, basically the motivation system, the dopamine system, we're the substance is providing too much of a dopamine reaction. So if you consider this seesaw, right? It's like we or whatever the drug is. I don't know if that's the case with the drug, but let me just follow the dopamine thing. And again, the equal and reactive, your body needs to go back into homeostasis, right? So there's always a little bit of pain associated with balancing out the seesaw. And the problem is when you repeat, 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 and you don't let the seesaw balance out, your body, which is creating it amazingly, says, "Oh, you have this substance. I don't need to produce dopamine anymore. I don't need to produce these substances anymore." Then, and by the way, I've worked years to figure out how to do this language without, the technical terms, but so your body is readjusting to what it thinks is normal state. And so when you don't have the dopamine your body normally produces, or all the hormones that your body is, or neurotransmitters that your body is supposed to be producing, it's going, warning, 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 need those neurotransmitters, and so it activates the fight or flight. And that's why we need to reach, because we're trying to get our body back in what it believes is homeostasis, which is a level above where we should be. Is that kind of a weird, like, uh, where have I gone wrong here?
No, no, that makes a lot of sense. I like what you said about the repeated stimulation and what it does to the brain. It really does get to a point where the brain is burnt out. It can't keep up anymore. So going back to alcohol, as I said, it's different for the various substances. But if we go back to alcohol itself, what is happening? Well, hormonally, when a person drinks alcohol, it's going to start depleting testosterone. Testosterone raises dopamine. So if we deplete testosterone, Now we're losing our dopamine. The other thing that's happening with alcohol is that it is shutting off a couple of parts of the brain when we're drinking. One is the prefrontal cortex. The other one is the cerebellum. That's why people stumble. That's why they have a hard time walking, or coordination is impaired when the cerebellum is offline or decreased in its function. When the prefrontal cortex is decreased in its function, impulse control is impaired. So a person is doing
I know
things that
that
they
one.
wouldn't normally.
Everybody listening knows that one.
Right, that's a big one because the repercussions can be so huge. What's also happening is that glutamate is being decreased while GABA is being raised up when a person is drinking. It's kind of like a benzodiazepine. You can sort of think about it that way. And then the equal and opposite reaction of all of that is highly problematic. So that's when a person is going to start, if it's drink, 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 especially if there's a dependence. And so a person is even drinking in the morning and all throughout the day, or they're having withdrawal symptoms. So the gas pedal is down all the time and the body wears out. It's like driving a car where you are revving, just constantly revving. Things wear out. And that's essentially what's happening. Now, that's obviously a hugely simplistic version of it. And there are many other factors, including the toxicity that we talked about a little bit ago, too. But that's a little bit of a way of thinking
And
about it.
and I think you know this in my history. So I'm going to assume that nicotine is a different reaction than the alcohol, but I first started with nicotine in a manner that you describe. It was the first thing I did in the morning and the last thing I did before bed. My body was truly in panic mode without constant administration of that drug. It was horrible. And maybe I would have gone there with alcohol. Alcohol was pretty bad. I mean, my levels of intake were shocking. But I didn't have to start at 8 a.m., thank God. But I'm sure it would have gotten there if I would have continued. But where was I going to go with this? What's the difference? Is it only a matter of time where the alcohol would have gone to that same place? Or is it because the nicotine may be more of an addictive, a more highly addictive substance? What do you think the difference is there?
So, some people are more vulnerable to developing addiction than others. They actually have a predisposition. And we looked at your brain, spoiler alert, you have that predisposition. So the next time you and I talk and we review your scan in particular, we can let people know about that. But if people have that predisposition, then a substance can very quickly put the brain into a place of, I
Um,
need, whatever it is, I need. So that's the craving component of things, which makes it really hard for people to stay away from the substance that they're trying to quit when they are trying to quit. That I need feeling, in addition to whatever the substance is doing to the brain in the first place. You have been uniquely addicted to things that decrease anxiety. However, equal and opposite reaction, both of them, when you try to stop, or if you go an extended period of time without them, up and away goes the cravings
and the
and
anxiety.
the anxiety.
Yeah, so it's the massive lie is that the substance. And so what we both try and do, right? You in a clinical setting, me in a non-clinical setting, is to try and get the um, anxiety solved in healthy ways. Because boy, the lies are just there. And it's repeated attempts at awareness of like, wait, yeah, I thought I romanticized about this. I went for it. It just caused shame, sickness, disgust. Okay, and then finally you go, okay, enough is enough. I know what's going on. I'm ready to do something with it. So, all
You know,
right, what's
the
that?
reason I just want to say the reason that I really like this scanning is because, as we talked about in the beginning, it takes away some of the stigma. Stigma is a huge issue with people not getting help because they just don't want to be put into that box of, I'm weak, I didn't try hard enough. There's something wrong with me personally. I'm not strong enough, whatever it may be. Well, when you do the scanning and you can actually see the parts of the brain that are challenged, and then you can correlate that with the substance that the person is using, it becomes apparent that they are self medicating. And so it's not a weakness, it's not a personality defect. They are trying to self medicate, they're trying to make themselves feel better. But there are ways to do that that are not problematic. And that's where the healing comes in, the treatment.
Well, and COVID, oh my gosh, right? I mean, COVID was a proving ground, or not, it was just the perfect, I don't even know the words, but the perfect storm for addiction, even in people that weren't pre-wired for it, because shut down, massive stress, massive anxiety, unknown, no, where's my job going? How am I dealing with the kids in the house? How are my kids going to learn? I mean, right? That's a lot of things to deal with. Isolation. And guess what? The liquor stores were deemed to be a necessity. Not only that, restaurants were now allowed to deliver it with food orders. And people would say to me, I never had a problem before, but now I do. But they were medicating, and they were told that it was okay to medicate with alcohol. It's just it's heartbreaking, heartbreaking. Okay.
During the pandemic, I was actually working in a detox center, and our admissions for alcohol detox went through the roof.
Right. Yeah. Yeah. It doesn't surprise me. I know a lot of nurses that work in emergency rooms. The incidence of alcohol related problems, whether it's domestic violence or overdosing or, whatever else, accidents out of stupidity, car accident, just pretty overwhelming, and it needs to be talked about more, right?
Absolutely needs to be talked about. That the only way we can release the stigma is by bringing light to it and having some sense of normalization around it, because this is so much more prevalent than people realize. And while people are feeling very alone in their addiction, they really try to hide it. They try to be very private about it. That's exactly the thing that feeds the addiction even further. So shining a light is critical.
Yeah, I agree 100%. So we know how, and by the way, statistically, I think according to SAMHSA, we're at 17.3% of the US population with some sort of substance use disorder. Let's just round up because that's what they know about. I'm going to call it 1 in 5. That's pretty stunning, right? And it's such a wide range. It starts with the person who started at COVID and goes, "Uh-oh, I can't control this anymore," right? It's not full blown, but unless we start talking about it and figuring out how to redirect behaviors, right? But 1 out of 5 is pretty big. So we know why we use it. We know that it's not doing anything beneficial for our health and well being. But let's talk about the neural pathways that are developed because we've chosen to repeat a behavior over and over and over again. There is physical withdrawal, which I believe you can get back to a period of homeostasis within 2 weeks to 30 days for alcohol anyway. You can speak to maybe other substances. But after that, and that's what I more want to talk about, not maybe the clinical, but what we're dealing with after we've gone through our withdrawal. Um, what are we left with? Because it's not solved when we bring the body into homeostasis. We're left with a neurological pattern and habit of triggers and rewards. So, can you talk about that from a brain science point of view and maybe some things that you see need to be done to redirect those patterns?
The
Or,
way
I'm sorry, even better, how you might see that in a brain scan, right? Like, what are you looking for in a brain scan to determine this? Yeah.
So, the way I think of any kind of a behavior that we do over and over and over again is that we are creating neural networks that are firing together on a regular basis, and therefore they're getting stronger and stronger and stronger. They're getting reinforced. And it's kind of like a dirt road where you have a tire that's going on the same spot in the dirt road over and over again. Eventually, you've got a divot. And that divot, the more it's driven on, the deeper it gets, the harder it is to steer the car out of that divot, and the easier it is to pull right back in. So that's definitely happening within our brain with the neural networks, with regardless of whether or not it's a substance that's being used or if it's a behavioral kind of an issue that's going on. And the brain wants to rebalance, and the body does a beautiful job at coming back into a place of homeostasis if it's given what it needs to do so. And that's the kicker there. So I did work in addiction for several years. And what I found is that people, and this is in the literature as well, this is not just my finding, people are in a heightened state of risk for relapse, of course, in the very beginning. They're earlier on in the addiction because that groove is still very deep. They haven't had the time to fortify their body yet to really put it back into a state where not only are they just simply in homeostasis, but all of the depletion that occurred when they were in active addiction has then been replenished. So there's something called post-acute withdrawal symptoms. That can actually go on for 6 months to a year. So a
Wow.
person can get sober in a short period of time. They can get out of detox within maybe 7 days, sometimes even less, depends on what they have going on. Then they may go into a residential treatment center where they live for maybe 1 month, maybe 2 months, maybe 3 months, depending upon the place that they're in. And in that time, what the doctor that's taking care of them is really trying to manage is the depletion that has been going on inside of a person's body and brain. But how they manage it is really important because if a doctor is trying to manage symptoms with just medication alone, but ignoring the basic building blocks of biology, then they're not going to get to a place of being fully fortified against relapse. Does that make sense? So we have these building blocks, these nutrients, these phytochemicals. We have these fats that build our body, these proteins that build the body that makes up who we are, that helps our proteins to function properly, makes our cells function properly. If there are depletions there, then things don't function quite as well.
Right.
Medication, while it can be helpful for symptoms, is not giving us proteins, electrolytes, the carbohydrates that our body needs, the nutrients, the key nutrients, the folate, the zinc, all of those really important things. And functional medicine is very important. Functional medicine is investigative medicine, essentially. It's always looking at root cause. And that's what I'm talking about, root cause. And so the testing that lets us know what specific deficiencies a person has and what kind of genetic vulnerabilities they have to these specific deficiencies is critical. And I'll give you an example. There are some people that have a genetic deficiency called MTHFR, methylene tetrahydrofolate reductase deficiency. So it's a super long name. We give it an acronym. Some people call it the mother gene, but it's MTHFR. So this is something that we get from mom and dad. And what we receive from them determines a couple of things. One is how we're methylating our DNA, which is important to know when things are shutting off or turning on. It also allows us to convert folic acid into L-methylfolate. L-methylfolate is the only form that crosses the blood-brain barrier and is therefore available to our brain to make neurotransmitters. People that have this gene deficiency sometimes have a difficulty with having the conversion of folic acid, therefore having enough of the building blocks necessary to make our neurotransmitters. So they are at a deficiency because they're missing a specific enzyme that allows them to have that deficiency fulfilled or
Mm.
replenished. So it's important to know that. And that's just one of a variety of other genetic deficiencies that can exist in our body that are important to determine and to personalize to make sure that each individual person that is trying to get sober has the best chance that they have of getting sober.
Right, right. And so I think what I hear you saying is, well, I'm hoping that yeah, go back. I have so many thoughts going through my head um, because I know my program is 12 weeks, just so you know. I don't know if you know this, but I challenge people to get to 12 weeks because before that period, I'm not sure that there's enough confidence building in the momentum that we're getting to see. And then I say, now it's your choice to move forward as to whether or not you are going to engage in that substance. And of course, people will choose it many times, but a lot of times when we empower people to know that those moments are going to come, but they're moments and they pass. And as long as we're continuing to learn other ways to be healthy. And I think what I hear you say is, and of course what I heard you say in my consult too, is these things like eating right and exercise and understanding where our body is deficient in various nutrients, right, that are causing our healing to take longer than it can, right? Is I'm trying to match up the am I doing okay? I think what you're saying is we're missing things, like just genetically, we're missing things. And it's important to know, but that's why healthy diet and exercise are important. I mean, yeah, we'll save for episode 2, but there was an aspect to my exercise that you even wanted to tweak that was going to make a difference in how my brain scan showed up. That was fascinating, right?
Oh, absolutely. So I want to double back just for a second to just comment on what you mentioned because I think that's very important. Yes, getting to 3 months, incredibly important, and that's why most recovery programs do end after about 3 months. Not recovery programs outside, so at home, but what I mean by that is residential. Usually, people go into a residential, and then they're in an IOP, and then a PHP, a partial hospitalization program, and then they're on their own, and then they need to continue their own recovery program, whether it's meetings or whatever it may be. The deck is stacked for some people more than others because our biochemistry is different from person to person. So, whereas some people may be able to go through a recovery program and stay sober once, there are others that have the deck stacked against them.
Yeah.
I'll give you an example. If someone has decreased activity in their prefrontal cortex, which can cause ADD, attention deficit hyperactivity disorder, can be present in childhood. So we've all seen it, right? The child at the grocery store who's bouncing all over the place, touching everything. Mom is trying to keep everything kind of in place. That child, if that child does indeed have ADD and goes untreated, is actually more likely to have addiction because there's an impulse control issue.
Mhm.
Now, if that same person goes into a recovery program and they have impulse control issues, then the end of 3 months for that person and their ability to make a choice for sobriety is different than someone who doesn't have that.
Right. And thank you for clarifying that because I'm very aware. Remember, I'm not a clinician. I'm not a psychiatrist or a therapist, right? So there's this wide range of AUD. And I am constantly sharing with people that understand what level of care you need because I can help a lot of people with sometimes just the devotional alone is life saving, right? I don't understand that. I needed a higher level of care, right? I needed EMDR, and I needed medications, and I needed coaching, and I needed all kinds of things, right? But there are just different levels of care that people need, and you're describing a level of care, and I love that because so many people are beating themselves up as if it's, oh, there's something wrong with me. No, but let's just look at it and address it. And yeah, I love that. Thank you for sharing that. So we've done something over and over. We've established neural network. We're working through it and trying to find healthy ways to cope, which include diet, exercise, supplements, and sometimes medications, right? What's happening to our brain as we're addressing these things properly with all of the above?
So, specifically with alcohol, when we see people come in on brain SPECT imaging, we tend to see again that their cerebral cortex, the decision making part of the brain, the mood stability part of the brain, the learning, the attention, it tends to be it tends to show us low blood flow. So a person is not receiving the blood flow that that part of the brain or those parts of the brain need for proper function, and therefore those functions suffer. When they stop drinking and they start adopting healthy lifestyle, the things that you just mentioned, staying hydrated, healthy foods, making sure that they're getting good sleep, making sure that they're getting good exercise, prayer, meditation, those things create the cornerstone for our brain now to receive what it needs for proper function. On the other way that we looked at the brain, because we look at the brain two ways, blood flow and activity levels. The other way that we look at the brain is, of course, levels of activity. And depending upon where a person is at in their addiction, they may be really lit up in their emotional centers, or things may be very quiet. If their mitochondria are really suffering, things are quiet. So again, we do all of those important foundational things and it tends to normalize. Now, it doesn't fix everything because just removing the thing that a person was using to get through the day doesn't fix the reason they had a hard time getting through the day in the first place. So it's important
Right.
to then, yeah, it's important to figure that out. So that's where the investigation comes in. What's happening? What kind of trauma is there that needs to be dealt with? What kind of deficiencies are still lingering? What kind of exposures might have been going on that caused a person to have a hard time? Could it have been something like mold or strep or COVID or Epstein-Barr virus? What was happening that was causing that? Is there an inflammatory issue? Is there a medical issue that was making it hard for the brain to function properly? And then it's important to address that. So there are layers of things that need to happen, and all of those things are really important for ultimate success. And I do want to make sure to convey to everybody, and I convey to my own patients as well. And again, this is repeating myself, but this is not a character defect. It's not a flaw in who a person is. It's a matter of us trying to figure out what was the reason that they used the coping that they used in the first place. And then how do we do something about that so that we can get them back to a better place where they can make very conscious decisions and they can feel a sense of fulfillment and happiness and contentment and joy throughout the days or throughout their life.
And you do see, I'm sure with all the experience that you have, the good news is that the brain is, what do you want? It's pliable, it's changeable, right? It's constantly changing, growing, learning, getting healthier. And I mean, we'll talk about the stuff that's left for me and the stuff that's that's I was kind of happy to see no bumps on my brain the way Dr. Amen shows some of the bumps with the alcohol. So I'll just lead you in on that. So that's the great news, and I love it. This is consistent with everybody in my community that says, "Look, I took the substance away. The problems are still there, but now I have some clarity to deal with them better, right? And I remember the first time I didn't feel well when I wasn't drinking, and I was like, "Well," I used to always say, "Well, it's because I drink too much. I drink too much." So now I can say, "Well, that's off the table. What else could it be?" And address it, is it because of this? Is it and you've cleared the table because when a substance is involved, especially alcohol, you're putting poison in your body, your heart's getting messed up, inflammation is everywhere, your brain isn't operating. I mean, it's just like, wow. Like, why didn't anybody tell me? I say this all the time. And so you and I, Dr. Parsons, are telling people this is what's happening. And the problems don't go away, but your ability to deal with them does. So now you can start seeing professionals to solve the remaining problems. Amazing, amazing. We are going to continue our conversation in the next episode with me. Is there anything you feel like you wanted to say that I didn't give you the opportunity to say about just brain health and or things that you see that you just want to share with people while you have that opportunity?
I'll share that in particular stigma of mental health is something that I have been very passionate about for a lot of years. So I've been a physician now for almost 20 years, and it's something that I was passionate about even prior to that because I had mental illness in my own family. I had addiction in my own family. And I knew these people. They were lovely. They were lovely people. And yet there were these things going on that made it hard for them to really engage with society, with others in such a way that they could gain traction and get to a place of feeling comfortable. And so it was a real struggle. And part of the reason that I love this work so much is because it allows people to see the evidence. Prior to having this kind of imaging, it was more like, well, look, you've got this chemical thing going on inside of the brain, and that's why you're having a hard time, which is good to hear. But if we don't see it, then we can't really stand behind it. We can't really wrap our arms around it and allow it to change us. But when we see our own brain, and we then develop this relationship with our brain. We have this then much different and deeper sense of compassion for ourselves throughout our entire journey and compassion for the choices that we've made. So we can really give ourselves that grace. And it's hard for us to move forward because we have to have forgiveness before we feel worthy of being better, of doing better, of feeling better. Forgiveness, self forgiveness is huge. And this is a tool that allows a person to make that leap. There are many tools out there, but this is another one that the medical community can provide just to see what's really going on.
Yeah, I love that. Thank you for sharing that. And I kind of feel the same way because of the stigma. I probably got I suffered for 10 years needlessly and getting worse because of stigma. And when people figure out, wait, this is how my brain works and I can change it. And that's what you're doing. You're like, look at this picture. This is kind of what's happening. This is why. But here are the things that we can do and it can change. You're giving people hope. And hope is the number one ingredient needed to solve for addictive behaviors or substances. So thank you for the work that you do. I do. Yeah, a lot of people are interested in this work. I think it's important. I'm just going to be honest. Insurance does not cover what Amen Clinics is doing. Unfortunately, we're not there. I'm I'm looking to meet Dr. Amen next week at the AACC conference, and I'm going to say, how can we get insurance to cover this? Because that really needs to be priority number one, and it shouldn't just be. The insurance companies should want to. They're spending a lot of money on recovery, and society is spending a lot of money needlessly on addiction and in a bad way, right? Car accidents, deaths, healthcare costs. I am so healthy right now. I'm like, I've never felt healthier in my life. So we'll get there, right? Dr. Parsons, we'll get there.
We will we will get there. Boy, the medical establishment is like a big heavy tanker that is trying to shift gears with just a tiny little rudder. I think it's the rudder that allows the a ship to shift to move to a different direction. And boy, getting that to shift is really incredibly difficult. And as of right now, unfortunately, standard of care is what it's been, which is you ask questions, you talk about what's going on, and therefore extrapolate and treat based on that, as opposed to seeing what really is going on and then doing something about it. Imagine if what our cardiologists were doing were not covered by insurance, if all they could do was talk to their patients and hear about their chest pain and hear about the headache, which is caused by the blood pressure issues, and they had to treat based on that. And they weren't allowed to do an EKG or an echo or a stress test. It really is a disservice to our population. And it's something that all of us at the Amen Clinic are very passionate about. We all do try to get the word out. I think it does need to come from a grassroots place. And Dr. Amen, of course, is very vocal and he does teach. He teaches other physicians, they can take his certification program, but he also teaches at the main conferences, including things like the American Psychiatric Association conferences. It will happen, but it
It
takes.
will. It will. I know it will because it's too common sense not to. But well, I look forward to episode 2 with you where we get to talk about my brain scan results and some of the recommendations you've made for me to just continue on my journey of brain envy, for lack of a better word, right?
Such a pleasure to talk with you, Roseanne. Thank you so
Yeah,
much.
thanks, and I'll see you soon.